Hey guys, Dr. Laura here. Welcome to my period series, and today we're talking all things birth control. So that's hormonal, non-hormonal forms of birth control. As a naturopathic doctor, I believe that all my patients should have informed choice on when making decisions that have to do with their health care, and contraception is one of those decisions that we have to make. So it's a really good idea to know A, what are we getting? B, what are the side effects? And C, what is the right option for you? So I'm going to start with non-hormonal forms of birth control. I'm going to talk about their pregnancy rates or unintended pregnancy rates, how to use them, and then we'll talk about hormonal birth control, some of the side effects, and some of the risks involved. So first, starting with the male condom, this is one of the most popular forms of birth control used. Unintended pregnancy rates, when used correctly, is about 3%, but can be up to 15% based on improper use. So improper placement of the condom on the penis, using oil-based lubricants. So many people don't know that oil-based lubricants can actually break a condom. So you want to make sure that if you are using lubrication with your condom, that you are using a water-based lubricant. And then poor withdrawal technique. So a combination between the condom isn't on right, and then when you're withdrawing, it is slipping off, and that can cause unwanted pregnancy. One that's not used very often is the female condom. So this is only used in about 1% of women. Basically, it is a closed, almost tube. You insert it into the vagina. The end is closed. The bottom is open. And it basically is a barrier method because it stops sperm from being able to enter the vaginal canal or the cervix. Failure rates, though, within 6 months of use can be as high as 15% because they're either not used right or they're not used often, so the education piece isn't there. There's two other things, the diaphragm and the cervical cap. These, unfortunately, must both be properly fitted. So if you want to get one of these options, you have to go to your doctor and get it fitted properly. They have to be inserted before intercourse. So that can be kind of tricky, taking away the spontaneity. You have to really plan around intercourse. And typical failure rates for the diaphragm are estimated at about 20%, which is actually quite high. And with the cervical cap can be anywhere between 20 and 40%, so very high. So a lot of these methods are really difficult to use, especially the diaphragm, the cervical cap, the female condom. So that's why the male condom is very common, and these protect against sexually transmitted infections as well as HIV. So another form of non-hormonal contraception is the copper IUD. So I'm going to talk about the hormonal copper IUD, or the hormonal IUD, but right now I'm talking about the non-hormonal IUD, which is the copper. So basically, it works on the mechanism of creating a foreign body reaction in the uterus, causing an unfavorable environment for implantation. So failure rates or pregnancy rates are about 0.6%, which is really great, especially for a non-hormonal form of birth control. But it can cause heavy periods and painful periods. So if you're someone that already suffers from painful periods and heavy periods, this might not be the best option for you. And it also doesn't protect against sexually transmitted infections or HIV. The other thing, and the last thing I want to talk about with non-hormonal birth control is periodic abstinence, as well as the pull-out method. So periodic abstinence is basically when you avoid sexual intercourse during the time of a woman's fertile window. So this method does assume that sperm can only fertilize an egg 48 hours after intercourse. An egg is only capable of fertilization 24 hours after ovulation, and that ovulation occurs between days 12 to 16 of a woman's cycle. So the only thing that is incorrect there is that sperm can actually live in the female reproductive tract for up to 5 days, and all women don't ovulate between day 12 and day 16 in their cycle. So if we look at all of those factors, we're really creating a very large window of abstinence, and for a lot of people, that's really not realistic. So it is important, if you're looking into this, that you learn how to track your cycle, monitor your cervical mucus, and you want to track your cycle for at least 6 months before you start to even try and do this method. failure rates can be up to 25%, which is very, very high, and you can really see why. So I'm going to post a link. I have a free guide to tracking your cycle. I have a free guide to tracking your cervical mucus, and these can really help. I also would suggest getting maybe an ovulation kit as well to increase the accuracy of predicting your ovulation and really add more information to your tracking methods. The last thing I'm going to talk about with non-hormonal birth control is the pull-out method. So this basically just involves withdrawing the penis from the vagina before ejaculation, and the effectiveness really just depends solely on the man's ability to withdraw in time. Failure rates, if perfectly used, are 4% within the first year, but can be as high as 22%. So these are all things that you should really consider when thinking about wanting to do non-hormonal birth control. What's the best option for you? And again, if you do decide to use hormonal birth control, it's good to know the risks and how it even works. So I'm going to run through some of the more common hormonal contraception, so the pill or the OCP, the hormonal IUD, and then we'll talk a little bit about some other hormonal contraception. So first of all, the pill. Basically, hormonal contraception works on the premise of using hormones to just not allow a hospitable environment for implantation. So through preventing ovulation, through thinning the lining of the uterus, because we know that we need the lining to be thick. So that sort of thing. If we prevent ovulation, we can prevent fertilization of the egg. So the pill, you have to take it every single day at the same time of day because that can interfere with your hormones. So failure rates or unwanted pregnancy rates are about 7% within the first year of use. And and then these also have to be metabolized by your intestines. So if you're taking medications, sometimes this can interfere with the absorption. So that's something to consider. The hormonal IUD, or commonly known as the Mirena, has a failure rate of less than 1%. So it's pretty great. It's kept in place for up to 5 years, and it basically emits low levels of hormones. And these are good because it's kind of a set it and forget it, and often results in a lighter period. And then looking at, there's the contraceptive patch, the contraceptive vaginal ring, which is a little bit newer, and then injectables, also known as Depo-Provera. The contraceptive patch really depends on your ability to keep it on, your ability to absorb. So if women over 198 pounds aren't able to actually effectively absorb the hormones, and then making sure it doesn't come off when you bathe. The contraceptive vaginal ring is basically a flexible ring that you insert into your vagina, leaving it for 3 weeks, removing it for 1 week to allow for menses. And then the injectables, or Depo-Provera, is an injection you get every 3 months of progesterone only. So what are the side effects? This is the most common concern I get in practice with patients who are on hormonal birth control, is they don't want to deal with the side effects. So it really depends on what you're looking for. So depending on what hormones are in your hormonal contraception will really determine what sort of side effects you can expect or you can be at risk for. So when we're looking at hormonal contraception with both estrogen and progesterone, some adverse effects you can have is nausea, breast tenderness, bleeding between periods, headaches, loss of a period, and that's with both hormones together. And with the addition of estrogen, though, some safety concerns are the increased risk of blood clots, especially in women who smoke and have a pre-existing cardiovascular condition. Additionally, if you have high blood pressure, estrogen probably isn't right for you because it does increase your blood pressure. So progesterone-only pills do have side effects, ones that I've already mentioned. So nausea, breast tenderness, headaches, loss of period, but does not increase your risk of clotting. So the best choice really, really depends on what you're looking for. So the patch and vaginal ring can be really helpful for reducing nausea and vomiting since they don't have to go through the gastrointestinal tract, and they don't require that for absorption. The vaginal ring may cause vaginal irritation, may cause yeast infections, may cause additional discharge, can slip out during intercourse, and can be irritating for your partner. No long-term studies are really available for this because it's a relatively new form of hormonal birth control. The contraceptive patch, like I've already mentioned, can result in failure if it is A, not absorbed, or B, comes off during bathing, let's say. The IUD is advantageous because it stays in its spot. It's been shown to decrease endometrial as well as ovarian cancers, but does come with the increased risk of potential uterine perforation at the time of insertion. So that's the same thing with the non-hormonal IUD. You want to make sure that whoever's inserting it has experience in that area, and you should be okay. Lastly, the injectables, so Depo-Provera, have been actually shown to decrease risks of endometrial and ovarian cancer. However, have also been shown to decrease bone mineral density, which actually increases your fracture risk later in life. So it's really good to know these pros and cons, be aware of what kind of adverse effects or side effects you should expect from either of these birth controls, as well as knowing the efficacy and the pregnancy rate, so that if you are really trying to prevent pregnancy, you can do that in the best, most informed way possible. If you have any questions, feel free to reach out. You can always email me, laura@laurapfeiffer.com. Otherwise, you can follow me at Dr. Laura ND on Instagram. You can like my Facebook page, Dr. Laura Pfeiffer, naturopathic doctor, and I will post all of the links to all of the things I mentioned below so you can make sure you get all of your free guides.